Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Detection of methicillin-resistant Staphylococcal aureus. Methicillin-resistant Staphylococcal aureus are mainly detected by the antibiotic susceptibility testing on Muller-Hinton agar. So first you will take the Muller-Hinton agar. This is Muller-Hinton agar is a disc-like is an agar plate. In the agar plate, you pour the lawn culture of the organism with Muller-Hinton agar, and then you put the antibiotic discs in the agar. So these antibiotic discs like methicillin, oxacillin disc and cefoxitin discs are used. And after that we will have to put the media at 4% of sodium chloride, and you should incubate it at 30 degrees Celsius, and you should do a full 24-hour incubation is done during this condition, and you will have to maintain these conditions, and then you should wait for the growth of the organism. Now based on this you will have the different antibiotic susceptibility colonies are seen. If the patient is if the drug is antibiotic susceptible, so you will see that over this discs, around these discs, the bacterial growth is not seen. Whereas if the bacterial growth is seen around these discs also, then that means the organism is resistant to the antibiotics. So by this way we can find out the methicillin resistant Staphylococcal aureus.
thank you and thank you for watching.